Since the Columbine massacre in 1999, the Washington Post says at least 185 children, teachers, and others have been killed and 369 injured in school shootings. More than 300,000 children in more than 330 schools have also been exposed to gun violence during school hours. ABC News medical contributor and Stanford Children's Health physician Dr. Alok Patel joins me live now to discuss the mental toll these shootings can have on children who survive them. Dr. Patel, thanks for being here. You say that gun violence should be viewed as a public health problem. Why?
And Diane, good morning. It's good to be here with you. And I am by far not the only person who thinks that gun violence should be viewed in a public health scope, but this is also echoing major medical institutions, including the CDC. You know, if we just look at motor vehicle accidents, which used to be the leading cause of death in pediatric population, that has now gone down because it was viewed in the same scope we should be viewing gun violence as. When you identify the problem, you're now going to be looking at data related to harm reduction. How do we reduce the amount of gun violence related injuries and deaths? How do we actually put that and implement that into communities, identify risk factors, look at what works, and then look at widespread adoption? We remove the politics and just go straight to the data. That is what we've done for everything from motor vehicle accidents to influenza to COVID-19 to drowning. That is what we need to do. That is what the new current CDC funding hopefully is going to accomplish moving forward when it comes to gun violence.
So what's the impact that events like this have on kids, both ones who were there and survived these kinds of events, and also, you know, kids watching on TV asking their parents what's going on and maybe afraid to go to school right now?
And it's horrific, the impact this has on kids' mental health, not only acutely with regards to anxiety, fear about going back to school in public, but even long-term with some kids exhibiting symptoms of general anxiety disorder, panic, or even PTSD, especially in young children. I'm glad you brought up the Washington Post tracker and looking at 310,000 kids who have been exposed to school shootings since Columbine. You also have to look at the undisclosed number of kids who have been around gunshots in their neighborhoods, had a family member or a friend affected by firearm violence as well. I'll bring up two studies, both from JAMA. One was actually looking at kids in the age 11th and 12th grade, looking at the impact that school violence had on them, and they were found to have an increased risk of anxiety and panic disorder 6 months after stating they had fear of being in their school environment. And a more recent study that came at the Children's Hospital of Philadelphia with UPenn, and what that basically showed was that kids related to the proximity of gun shooting in their neighborhood, if they were close to that within 4 blocks, they had an increased incidence of going to the ER for mental health issues. Dan, these are just two studies. We look a lot of times at the direct impact of gun violence, looking at those who died, and not enough time at looking at those who were just injured or the indirect effects of gun violence as well, and what that is doing to an entire generation of kids right now.
So if you're a parent and you see this in your child, how do you help them? And if you're a parent who owns guns, what kind of conversations should you be having with your children?
Well, based on research, to your first question, I think the very important two things for parents to do right now is make sure that you're checking in on your own mental health. You are seeking therapy, you're talking about it, you're acknowledging your own trauma, going to a board-certified healthcare professional, and then you're creating the same environment for your kids as well, creating that safe space, non-judgment free, for them to talk about what they're going through, making sure that they still have routine in place. This might sound similar because we talked about these same measures when it came to COVID-19 in the very beginning. Any type of adverse childhood experience can have long-term effects on kids. So kids need to make sure that they still have routine, they still feel security, and they're allowed to speak about what they're going through. That's extremely paramount. Now, with regards to safe gun ownership, this is a major funding point from the CDC to look at what exactly is safe gun storage. What are those prevention measures? This is why the American Academy of Pediatrics encourages healthcare professionals to talk to gun owners when we see that 1 out of 3 homes with kids living in it has a gun. So Diane, things like keeping a unloaded gun separate from the bullets, both in safe storage, measures like that, child access protection laws, all of it can greatly reduce the chance of a child finding a gun and unintentional injury and more.
All right, Dr. Patel, thank you as always. And tonight, you can watch our ABC News Live special, Guns in America, from Buffalo to Uvalde. That's at 8:30 Eastern, 9 Pacific on ABC News Live and streaming on Hulu.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.